91 Americans die every single day from an opioid overdose. That's why we've been tackling this national crisis all year on our show. Millions of Americans are caught up in this epidemic. They're looking for new ways to treat their addiction. And there have been some exciting new developments and therapies that have been approved recently by the FDA, because that detox and withdrawal process, even if you're trying to get clean, can be severe, can be overwhelming. Well, the FDA approved a device to help reduce opioid withdrawal symptoms. It's called the Bridge. And what it is, as you're looking at it here, small electrical nerve stimulators placed behind the ear that emits electrical pulses, and it stimulates branches of certain cranial nerves. And then these stimulations, what they do is help provide relief from the withdrawal symptoms you may be going through. Currently, it's only available by prescription. It's used in hospitals, community health centers, private doctors, and centers as well that deal with addiction. And you can use it up to 5 days during the acute withdrawal phase. I really like this because it doesn't use, one of the big issues with opiate addiction is using more drugs to treat it. This is a new way of treating it without using more drugs. And pretty impressive results. In a study, 31% saw a reduction in clinical opiate withdrawal, or 31% reduction on the opiate withdrawal scale. So everyone was seemed to be seeing some benefit.
And it makes sense, that so-called mastoid area behind the ear, that's sort of grand central station for those cranial nerves. You have the 5th, the 7th, the 8th, the 9th, the 10th cranial nerves. They have feedback mechanisms to the central nervous system, may affect the sympathetic nervous system. Physiologically, neurologically, there's a reason why this may be doing something.
It makes sense. It's not just a placebo effect, like taking away those.
But Judy, I think you'll be the first to say that, you know, in dealing with these tough addiction issues, that usually one modality is not enough.
Right, you need more than one. This is a great start though, because withdrawals are some of the reasons why people go back to using. They're so severe, especially for opioid withdrawals, or things like agitation, nausea, GI problems. All of their pain comes back, anxiety, depression, and so they go back and use even though they really don't want to. So this is an amazing thing just to get them through the first few tough days. And then after that, of course, they need to sort of combine both medication-assisted therapies and cognitive behavioral treatment to really get the best results. But the journey is still so far ahead. The first few days are crucial.
And the more treatments that we have, like I said, that don't necessarily involve more medications, the better. And these new developments, we know they're important. Why? Because opioid addiction rates have continued to skyrocket, almost 500% increase in the past 7 years. Anna is one looking for help.
I drank 6 beers by myself the first time I drank at 11 years old. Then when I was 15, a friend of mine introduced me to meth. We had gone to this very prestigious private school together, and I thought, how bad could it be? And I turned around one day and I was a meth addict. I was arrested on my dad's birthday, and I just felt like such a pile of garbage calling him from jail. It was actually my attorney's suggestion that I go to rehab. It would look good to the judge. I was there for 30 days, and I got out, I got high again. I ended up living in my car, and when I was 25, I went to rehab a second time. I ended up staying there like 5 or 6 months. I was like really into the idea. I injured my wrist, and I'm in pain, and they sent me to this doctor who would just give me 90 Norcos and send me on my way. So I just became really hooked on opiates. I stopped talking to everyone. I didn't want my real friends to know like what I was doing, who I'd become. And I didn't want to call my friends and say like, by the way, I'm hooked on opiates and now I need help. I just had hit a breaking point and went on like a 9 or 10 day binge. I thought, like, I'm for sure dying right now. And towards the end of that, one of the people that I'd reached out to called me and he said, I'm very concerned about your state of mind for your health. Like, I need you to get to see a doctor immediately. The more I taper down, the more I start to feel the withdrawals. The uncontrollable shaking, the freezing or the sweating or the nightmares. Every muscle in my body aches. There must be something better out there.